question for you, Dr. Jyotsna, is when we say girls 9 through 14, does it have any bearing on the timing of menarche? Can we wait for menarche, or should we do it before?
Not related at all. We can start the vaccine. We can start the vaccine. No relation to the menarche or anything. It is not going to affect. Now there is in a schedule, if the schedule is interrupted, that is one has taken the first vaccine and the second vaccine is interrupted, not taken at second month. So we can give it immediately as soon as possible, and the third one after 3 months. If the third vaccine is interrupted, like the person has taken first and second, third is left out, then take as soon as possible. Not necessary, even if they're beyond 6 months, they can still continue. Another thing is, if they have taken 2 doses or 1 dose of the Gardasil 4-valent, they can still opt for the 9-valent.
Okay. So what about the safety of the vaccines, Dr. Jyotsna?
They're completely safe. Just like any other vaccine, they can have a local reaction at the injection site. There can be a pain, swelling, redness. There can be mild fever or muscle pain, myalgia, which we call. There can be any of these symptoms. Sometimes they can cause giddiness or a fainting spell. So these have to be given when a person is sitting down. Just the next. Can you click the next, please? Yeah. So they have to be given when they are lying down or in a reclining position. They are given in the upper arm. Next one. Yes. And they should be like any other vaccine. When we take, we monitor the patient for 15 to 20 minutes, make them sit so that they don't have any allergic reaction to any of the ingredients in the vaccine. And if there is something, the person should be, the environment in the clinic should be ready for it.
And what is there any contraindication? Is there any guideline as to who should not receive it?
Yes. A person who has taken a first dose and had severe allergic reaction, where they got the reaction in their face swelled up or their throat swelled up and their voice, they couldn't breathe or something like that, and they needed emergency care, these are the people who should not be given vaccine. If they are allergic to any component of that vaccine, especially the yeast, the yeast which you make bread with, that yeast, if they're infected, if they are allergic to, they should be avoided. Pregnancy is not absolute contraindication but avoidable. If they have taken it inadvertently, we do not go for MTP, but we directly don't give if they are not pregnant. Lactation, they can take it, not a complete contraindication, though we do not know there are not much studies done about its release in the breast milk. People who are moderately or severely ill due to any other reason, acute febrile illness or any kind of, they can wait for some time till they overcome their acute illness, and then they can go for the vaccine.